Welcome to SFR Learning. I am Dr.S.Subharanjani from Department of Microbiology. In forensic science, today we are going to see about forensic toxicology. Forensic toxicology, in this video we are going to deal with the introduction, scope and key concept of forensic toxicology. Before move on to the forensic toxicology introduction, what is toxicology? Toxicology is a science dealing with properties, actions, toxicity, fatal dose and the estimation and interpretation of the results of toxicological analysis and treatment of poison. Forensic toxicology is a branch of forensic science that focuses on the identification and analysis of the substances, that is toxic substances, in biological and non-biological samples related to medico-legal investigations. It plays a crucial role in determining the presence and concentration of drugs, alcohols, poisons and other chemical substances in biological specimens such as blood, urine, tissues and hair. Next, we are going to see about scope of forensic toxicology. The scope of forensic toxicology deals with different types of specialty and each specialty having a major functional components. The first we are going to see is clinical specialty. In clinical specialty, the major functional component is causation, diagnosis and management of established poisoning in humans. In pharmacological, the assessing the toxicity of therapeutic agents. That is, even though it is a therapeutic agent, it is necessary to know the toxicity level of the therapeutic agents before we are incorporating into any animals. Next is forensic specialty, which establishing the cause of death or intoxication in humans by analytical procedures and with particular reference to legal implications. The next functional components belongs to the occupational specialty is which assess the potential of adverse effects from chemicals in the occupational environment and the recommendation of appropriate protective and precautionary measures. The next specialty is the environmental, which assess the effects of toxic pollutants usually at the low concentration released from the commercial and domestic sites into the environment, which is distributed either by air or water currents or by the diffusion into the soil. The next specialty is the regulatory specialty, which deals with the development, that is, it is an administrative function, so it deals with the development and interpretation of mandatory toxicology testing programs with particular reference to controlling the use. Next, the functional component belongs to the laboratory is design and conduct of in vivo and in vitro toxicology testing programs. The product specialty deals with the assessing the potential for adverse effects from commercially produced chemicals and formulations and recommendations on use patterns and protective and precautionary procedures. The aquatic specialty is relevant to the environmental specialty. The main difference is the assessing the toxicity on aquatic organism of chemicals discharged into only the marine and freshwater. The next specialty is the toxinology. It means assessing the toxicity of substances of plant and animal origin and produced by the pathogenic bacteria. That's all about the scope of forensic toxicology. Next, we are going to see about the key concepts of forensic toxicology. If you are a forensic toxicologist, you have to deal with certain concepts. First, you have to identify the toxic substances. The main aim of the forensic toxicologist is to identify and confirm the presence of toxic substances in various samples collected during the criminal investigations, accidents or unexplained deaths. Next, after a collection of sample, the forensic toxicologist must quantify the concentration of toxic substances, which is essential for assessing their potential role in a particular case. Next, the forensic toxicologist must identify the cause of death determinations, which means The primary goal of forensic toxicology is to determine if the toxic substances contributed to or caused an individual's death, which means if a person is died, we have to identify whether a death is caused by means of the toxic or any other substances. Next is or by the overdose or that is a suspected poisoning. Next is the postmortem analysis or antemortem analysis. Forensic toxicologists perform postmortem toxicological analysis on the samples obtained from the deceased individuals, which means the deceased individuals meaning is the suspected death, that is a death we are having a doubt. Next is the antemortem analysis. The antemortem analysis is a toxicological analysis on samples from living individuals such as either a suspect or maybe a victim. Next is the drug and alcohol testing. A forensic toxicologist must frequently involved in drug and alcohol testing, including the assessment of impairment levels in cases of driving under the influence and workplace accidents. Next is chain of custody, which means the maintaining a straight chain of custody is crucial in the forensic toxicology to ensure the integrity and admissibility of evidence in court. This involves documenting the handling and storage of samples from collection to analysis. Next is expert testimony, that is, they must often serve as expert witnesses in legal proceedings. They must present their findings and interpret in court to aid the judges and juries, which they have to understand the significance of toxicological evidence. Next is analytical techniques. They must employ a wide range of analytical techniques including gas chromatography, liquid chromatography, mass spectroscopy and immune assays to identify and quantify toxic substances accurately. Next, after an analytical techniques, they have to interpret the results. Means, in the context of the case, considering factors such as the individual's medical history, circumstances of death and potential sources of exposure. After an interpretation of a result, we have to prepare a report, which means prepare a detailed report summarizing their findings, including the substances detected, their concentration and interpretations of their potential role in that particular case. We have to collaborate with the forensic experts such as forensic pathologists to provide a comprehensive understanding of the circumstances surrounding a death or injury. After all, we have to maintain a database, that is, which should be accurate, which helps to identify and reference materials crucial for the identification and interpretation of the toxic substances. Finally, in 16th century, a Swiss chemist Paracelsus, he said that there is no substance in this world that is not a poison. It all depends upon the dose and the mode of administration. Forensic toxicology is a hybrid of analytical chemistry and fundamental toxicologic principles. The summary of this video is forensic toxicology plays a critical role in the field of forensic science by providing valuable information related to the presence and impact of toxic substances in medico-legal investigations. These are the references I have collected for making this video. Thank you for watching this video. Hope this video is useful for you. In the next video, we will see about the medico-legal postmortem and their examination. Thank you.